Well, thank you for joining us. We all know that mental health programs are important in all big cities. San Francisco is no exception. Michael Gause is with us right now, and he is the Director of Programs for the Mental Health Association of San Francisco. Nice to have you here, Michael.
Thanks for having me, Jack.
Your hands are full, I'll bet.
Yeah, a little bit. Got a full plate going on.
Yeah, this is a problem that all cities face in other areas too. Some of the programs that you're involved in right now are helping people who are homeless, right? Living on the edge, maybe in different hotels, moving from place to place. What kind of things do you do for these people?
So we come at, with the Mental Health Association, we come at it from a little bit of a different angle. We don't actually have clinicians or psychiatrists on staff. We look at it from a more kind of broader global perspective, trying to change attitudes and also reduce the stigma around mental illness. So instead of doing one-on-one work with clients, we have programs like our SOLVE program, which stands for Sharing Our Lives, Voices and Experiences, where we actually have about 25 speakers from all walks of life who share their stories about struggling with mental illness and overcoming mental illness with places as diverse as corporations to nonprofits, with the idea of reducing that stigma around mental illness.
Okay, if you have somebody who's been on the edge, you know, maybe sort of in and out of reality to a certain extent, don't you refer that person, those people, to psychiatrists, psychologists, and so forth?
Absolutely, yeah. We have we do a lot of information and referrals. When you have a name like the Mental Health Association of San Francisco, we get quite a variety of phone calls each day. But we actually have another program that focuses on folks who are struggling specifically with psychosis and schizophrenia, called the PrEP program, which is Prevention and Recovery of Early Psychosis.
Yeah, but that's a difficult area.
It is, yeah. But that actually, we're targeting 14 to 27-year-olds. And while we do the outreach and kind of the marketing for that, we have partners at UCSF and Family Services Agency who are screening folks and trying to get people help early and involving families. So that's a really exciting program.
Okay, exciting in what sense?
Well, it's an innovative program. I think when you talk about programs like the PrEP program and the SOLVE program, we talk about treatment as usual, which is maybe a 15-minute meeting with a doctor or over-medicating someone. This is innovative because it's really targeting the person and the family and working with the family and the person, and also reducing the stigma around mental illness.
Okay, family has Uncle Joe, and Uncle Joe's been eating candles lately or doing something a little strange, and they want to get some help. Can they call the Mental Health Association and say, can I get some help with my uncle here?
Yeah, absolutely, yeah. They can call us. We're happy to speak to anyone and refer them out to the appropriate place. More than likely, it might be something we have in-house. But we can definitely do that.
So referral is a big part of what you're doing.
Yeah, referrals and also advocacy. Being down at City Hall when we need to be down at City Hall, fighting for our constituency, and advocating across the city and state on behalf of.
A couple of minutes ago, before we started this, I asked you about redevelopment in the city and how that forces people into smaller and smaller areas. But those people are still with us.
Yeah.
I mean, they haven't left. They're still just hunkering down in a hotel somewhere in their room or isolated from people. Isolation is a big part of this, I imagine.
Yeah, huge.
Yeah. How do you deal with that?
So
how do you help with that?
Yeah, I think when I talked about our SOLVE program, where we have people going out and speaking publicly about their mental illness or their struggles with mental illness, and that's one way to really reduce and diffuse that isolation. We speak to folks in hotels directly who may be suffering from mental illness. We speak to their providers, doctors, and the idea is to kind of diffuse that and make it seem okay, or make it okay, which it should be. What we always talk about is, if you have cancer or diabetes, not something most people feel afraid of talking about, but if you say you have depression or struggling with schizophrenia, that's a lot more stigma around that.
Yeah.
So,
how successful are you?
Very successful. I'd say we've had about 65 talks this year and reached several thousand people as part of that program. So word's getting out.
Okay, well, let's remind everybody that the program is there, Mental Health Association. If they need some help, not to hesitate to call or use your website. Okay?
Especially with the holidays coming up.
Yeah, absolutely. It always brings on something extra at that point. Okay,
so.
Michael Gause has been our guest, and he is Director of Programs for the Mental Health Association of San Francisco. Thanks for watching.